are in listen-only mode.
One of the with a laptop. Ask her to come down here. Thanks. Okay, someone's on the way to fetch Michelle to bring her in my office.
Okay, we are now live. Good afternoon, everyone. My name is Tiffany Simpson-Crumpley, and you have now joined us for the 7th installment of the South Carolina Office of Rural Health's Best Chance Network and Wise Woman Rural Training Series. This is a strategic partnership between our office and DHEC's Best Chance Network and Wise Woman programs. The focus of today's webinar will be Wise Woman, the win-win solution for patients and providers. Joining us today is Linda Peckery, who is the program manager for Wise Woman. She'll be giving an overview of 3 comprehensive services that are also offered to women in the Wise Woman program. Michelle Harris will give us education around the National Diabetes Prevention Program, and we have a treat today where we actually have a living and breathing Wise Woman health coach that does this work all day, every day. So she's going to share her lessons learned and the type of work that she's doing with women at Little River Medical Center, which is a federally qualified health center in the Myrtle Beach area of South Carolina. With that said, I'm going to go ahead and move us forward. Today's objectives is to give you education about 3 comprehensive services that are offered through the Wise Woman program. The Take Off Pounds Sensibly program, the TOPS program, which is a weight management curriculum, evidence-based for low-income women, also the National Diabetes Prevention Program. This is also an additional service that can be provided. And at the core of these services and the driver of these services is breaking down Wise Woman health coaching. And so we've alluded to this in previous webinars, but today you actually have an opportunity to go in depth and learn how health coaching is activated in Wise Woman programs. I am your moderator for today. I am the education and training consultant for this endeavor, and I'm thanking all of you today for taking your time because I truly believe if you would take time out of your lunch hour, you are truly devoted to serving vulnerable women in your communities. And so that is my background. I've spent 19 years developing health and behavioral health systems of care for low-income women and youth in California, North Carolina, and South Carolina. Just a quick review, as I've alluded to, you've joined us for the 7th installment of this training series and education series. And so I just wanted to give you a quick review of what we've covered today. If you are interested in any of these webinar recordings, they can be made available to you by just simply sending us an email, and we can send you a recording. I am catching a little bit of static, so if any of you are on speakerphone, please mute your phones to reduce the amount of feedback across the line. So with that said, we've covered 6 topics thus far. We talked about the basics of implementing a Best Chance Network program, and the reason why we talk about these programs together because I refer to them as the dynamic duo of comprehensive health care for low-income uninsured women. Also, there is a clinical linkage between unaddressed obesity and uncontrolled high blood pressure and diabetes with the likelihood of developing cancer. So we want to offer these services at the same time, and in order to be a Wise Woman provider, you must also be a Best Chance Network provider. So we provided basic education as a start for that. Then we went deeper in terms of how you use your electronic health record system to engage patients in your program. So we had a wonderful lady from Singleton Health Center in Orangeburg talk about setting up email campaigns and telephonic or text reminders to remind women about annual screenings and bring them into your office, not just one time, but on an annual basis. Then we went deeper in terms of not only providing services, but making sure you have the tips and strategies to generate revenue through the Best Chance Network and Wise Woman program. So we had two analysts from DHEC, Latasha Chandler and Genevieve Gamble, give us education about the most common mistakes made on billing forms and just the type of documentation that they need to avoid delays in payment. The front desk, the gateway for effective patient management, really just went back to basics in terms of the importance of providing a wonderful customer service experience to your patients and really breaking down how that really impacts a woman's ability to be compliant. It impacts her trust with your facility, and really all healthcare begins with the relationship between the provider and the patient. And if that patient feels disrespected or mistreated in any way, it could really have serious consequences in terms of them not coming to get the care that they need. Then we moved into Wise Woman program information. So we've given an overview about the basics of Wise Woman services and making the case for Wise Woman. This was particularly a webinar devoted to really discussing healthcare statistics, morbidity and mortality trends in rural communities, and really imploring rural providers to start offering these services, because this is where the highest levels of sickness and deaths are from breast cancer, cervical cancer, as well as heart disease. And so really the whole point of this is, number one, to increase the number of providers in rural communities that are providing Best Chance Network and Wise Women services, and number two, to inspire you all to serve more women. So if we have more providers, activated and enthusiastic staff, more women can be served and ultimately lives saved. With that said, I'm going to go ahead and turn it over to Linda Peccary. She is the Wise Woman Program Manager. Very quickly, she's served in this capacity since 2013, but she has over 26 years of public health experience. She's a native New Yorker from Brooklyn and has a background, a bachelor's in nutrition and dietetics, as well as a master's in public health. With that said, I'm going to go ahead and turn it over to Linda. Linda, are you ready?
I'm ready. Hello, everybody. I'm really pleased to be here to present just a small portion of the Wise Women program, and also have some of my colleagues share their expertise as well. This slide shows the current healthy behavior support options available to South Carolina Wise Women participants. I will touch briefly on the TOPS program, and then Michelle will talk about the National Diabetes Prevention Program, and then Lisa will share her expertise as a Wise Woman health coach and give us some tips for getting these women engaged in health coaching. And just wanted to let everybody know that coming soon we'll be doing some expansion of health coaching, where we'll allow health coaching providers and Wise Women providers to do not only their in-house health coaching, but if they want to link these women to something that's going on in the community, like Zumba classes or swimming or a walking club, that we can count that all in as health coaching for the WISE program. So I want to talk about TOPS. So Tiffany, if you would go to the next slide. TOPS has been around for more than 60 years now, almost years. They are a nonprofit, non-commercial weight support and wellness group. They do have a proven track record for achieving healthy lifestyle changes and significant weight loss. In 2015, the U.S. TOPS members lost more than 300 tons of weight. And in South Carolina, our members lost more than 4,000 pounds. And again, these are clinically significant weight loss and healthy lifestyle changes. And then members who go through TOPS and reach their goal and maintain their weight loss become COPS. They keep off those pounds sensibly. Next slide. So TOPS is a network of local chapters that are led by trained volunteer leaders. Here in South Carolina, we currently have 48 chapters. And in the 22 WISE Women provider counties, there are at least one TOPS chapter, and there are a couple of counties that right now don't have any TOPS chapters to refer our WISEWOMAN participants into. But the good news is that anyone can start a chapter with 3 other people plus themselves. So TOPS will provide startup materials, they'll provide the curriculum, they'll provide the training. So if there's anybody who wants to start a TOPS group in their community, at their work site, at their church, in the healthcare center, we're definitely interested in having you come on board. So I would especially encourage any WISEWOMAN provider offices, if you don't have a local TOPS chapter, either in your service area or if you want one in your facility, please contact me, because it would be a really smooth referral from WISEWOMAN program into TOPS program for those women who choose to use TOPS as their lifestyle program. Next slide. A little bit about what happens at TOPS meetings. They are weekly, and they last an hour or less, and they're led by a trained leader. So again, the chapter leaders would receive all of their training from TOPS and all of their materials to conduct these meetings. Each individual who shows up at the meeting has a private weigh-in before the meeting starts. And then during the course of that hour, members, if they want to, can share their successes, their challenges, their goals, and just generally provide support to one another about their progress with losing weight and getting healthier. There's always a brief health and wellness topic presentation. And then what I think is kind of fun is that there's different awards for the best loser or a contest that they may have participated in, and recognition of the members who have reached their goals. And then if needed, there'll be a quick business meeting. And they always leave the members with an inspirational thought for the week to meditate on and to put into action in their lives. There is no obligation to join a chapter. Anybody could visit the chapter for free the first time to check it out, feel it out, see if it's something they would want to get involved in, because every chapter is going to be unique to the people that make up the group, or perhaps where it's located, and maybe even the facility where the chapter is meeting. In South Carolina, we have several chapters that meet in different churches. There are some that meet in fire stations. There are some that might meet in a local community club. So again, it varies throughout the state, and meeting by meeting and group composition by group composition varies. The downside is right now there are no Spanish-only chapters available in our state, but Wisconsin is working with TOPS headquarters in Milwaukee to develop Spanish language TOPS materials, and from what I understand, they have actually formed a local Spanish chapter for TOPS in Milwaukee. So I hope that I'll be able to get some information from that WISEWOMAN program and be able to share it with us here in South Carolina. Next slide. So what is TOPS as far as what the WISEWOMAN participant could expect? For one thing, South Carolina WISEWOMAN will support the WISEWOMAN participants' participation in TOPS for 1 full year free. That's a $59 value, so it really behooves a WISEWOMAN patient, if she's really wanting to check out TOPS, to go through and use the resources that we provide. The picture shown here is some of the materials that come in the membership package, and I think they're really neat stuff. There's a food diary that they can jot down what they eat according to the food exchanges, how much exercise they do for the week or for the day. There's a nutrition in the fast lane restaurant guidebook that lists calories and fat grams and would help people to choose healthy foods when they go out to eat. They get food exchange cards that shows how many cups and how many servings of different, fruits, vegetables, grains, etc., that would equate to their calorie goals and their weight loss goals. They get a really nice guidebook with all different types of information on meal planning, label reading, physical fitness, very comprehensive, very evidence-based things. And I myself am a dietitian, so I'm looking through these materials, and I can validate that they are credible, they're well done, and again, TOPS has been around with evidence in helping people lose weight for almost 70 years. So they get all that on behalf of the Wise Woman program, but the participant's responsibility to go through TOPS is that she would pay chapter dues of about $2 to $5 per month. That is not paid for through the South Carolina Wise Woman program. That would be her responsibility. And then she's also responsible for checking in with her Wise Woman health coach monthly to report her TOPS attendance and her weight information to the Wise Woman health. And then we expect her to attend at least 12 chapter meetings within the first 6 months of her joining TOPS. And that is for Wise Woman data purposes considered program completion. Next slide. So what about our Wise Woman providers? When they are providing risk reduction counseling during the Wise Woman screening visit, TOPS should be brought up as an option for that Wise Woman patient if she meets the following criteria. She needs to be ready to make a lifestyle change. If she's not ready, she doesn't have time, she doesn't care, she's just not at the point in her life where she thinks weight management is a priority, just move on from there. But if she's ready to change, she wants to lose weight, her body mass index is at least 25 or higher, she has access to a local or nearby TOPS chapter, and again, it would be really convenient if her Wise Woman provider office has its own chapter, and she chooses TOPS as her lifestyle program. Again, we want this discussion to take place during that Wise Woman screening visit to let her know that there are resources available to her through the Wise Woman program to help her get healthier. Next slide, please. And then as far as the Wise Woman health coach's responsibility, that health coach must follow up on all of the Wise Woman patients who receive a referral for TOPS and sort of navigate her through the TOPS program, provide her that monthly support with phone calls or face-to-face visits to, again, just provide that additional support outside of those weekly TOPS chapter meetings to really engage her in this lifestyle program and help her complete this program. And the good news is that that health coach's services are billable to South Carolina Wise Woman program, and I've listed here the reimbursement rates, anywhere from $45 to $60 for face-to-face visits, phone call depending on the length of that phone call, $10, $20, or $30, and then submitting that TOPS health coaching data through our online Medit system, that's an additional $5 reimbursement. And let me say that these reimbursement rates will apply for the national DPP Wise Woman participant and also the health coaching participant. So again, I want to encourage providers to have that discussion with the eligible women about TOPS, about health coaching, about national DPP as they are eligible for those programs, and really get them engaged in the programs, provide that monthly support, and then get reimbursed for those services. So that's what I have about TOPS. If you have any more questions, my phone number will be listed at the end, and you can call me or email me. So thanks so much. I'll turn it over to Michelle.
Hello, everyone. Let me pull the phone over. Linda and I are sharing a space because I've been without internet for 3 days, so it'll be an adventure. But I wanted to run through some information about the National Diabetes Prevention Program. And certainly you can get my picture off of there. Nobody wants to see that?
You are so funny. Everyone, this is a treat in terms of having Michelle on today. She has worked with DHEC since 2010 because, Michelle, I do have to do you the honor of introducing you since you volunteered your expertise today. So will you allow me to do that?
Yes, I will. That's fine.
Okay. So Michelle Harris has been with DHEC since 2010. She is a native of Philadelphia, Pennsylvania, a Philly girl who has transitioned to Columbia, South Carolina, and has been there for a long time. She has 19 years of experience in media and public relations. And actually is a radio personality. I thought I'd put that in there. And she also has a BA in political science from the University of South Carolina, so she is a Gamecock, and a Master in Fine Arts from Queen's University of Charlotte. With that, I will officially turn it over to Michelle to share information about the National Diabetes Prevention Program.
Well, Tiffany, thank you. And I've always enjoyed working with Tiffany whenever our paths cross. And please forgive the typo. That's what happens when you're working on a smartphone and bar. But yes, I am always happy to talk about the National Diabetes Prevention Program. You'll hear it referred to as the National DPP or NDPP. And basically, it's a public-private partnership with organizations aimed at two things: increasing awareness of prediabetes and giving an opportunity for individuals to prevent or delay the developing type 2 diabetes. Now, the partners come from all sectors, including government, business, nonprofits, faith-based organizations, healthcare organizations, so lots of folks coming together. And one thing that's wonderful about the National DPP is that it is evidence-based, it's affordable, and there's many standards that go along with it, so it's a very high-quality program when delivered correctly. Okay, next slide. Now, the goals of the National DPP, basically all of the partners, you're looking at offering a CDC-recognized lifestyle change program. And being CDC recognized means that if you download the curriculum or use the curriculum that has been developed by CDC, and then you use their guidelines and their standards, and you offer your data annually, the CDC will help review that data, give you TA as an organization that's offering the program, and then you can become officially recognized through the CDC prevention program, the diabetes prevention program through CDC. So once you begin offering the program, you are actually listed as a location that's available on their website, so anyone could look you up if they were looking for a provider in that area. But then you will go into a pending recognition status for 2 years, and then after they have reviewed your data with you, then they'll give you an opportunity to be an officially recognized program. And of course, the standards that we're talking about, we call them the DPRP standards, and basically that's just to make sure, to ensure the fidelity of the program and make sure that people are getting out of the program what they could potentially get out of it. Now, we have the opportunity through, you may have these numbers thrown around, either 1422 or 1305, but these are grant funds provided by CDC where we can partner with organizations. DHEC can partner with organizations that can offer the program to the public. And we, through 1422, which is the grant that I work on, we partner with churches, nonprofit organizations, public housing communities, free clinics, medical providers, businesses, both small and large. We are just looking to partner with organizations where the people are and can touch the lives of the folks that we are trying to get with. So we have had the opportunity now to partner with many different organizations. And basically when it comes to healthcare providers, what we're trying to do is get them to increase referrals to the program, get their patients to participate in the program, and basically make them, again, aware of prediabetes as a condition, and then say to them, here are some local programs available to you. We also are working with employers and insurers to get the National DPP as a covered benefit. Right now, there are definitely parts of it that have their own coding and can be billed, whether it's nutrition counseling, or there are different parts of it that can be, and we are looking at Medicare, in 2018, picking up the National DPP, and of course many insurers fall in line right behind Medicare. So we're working with that. We're very hopeful with that as well. But we're also working with employers to see that they can offer this as a covered benefit. Many employers do offer it as part of their wellness program to their employees, but it's not necessarily a reimbursable benefit through their insurance yet. So we're still working on that. Okay, next slide. One of the reasons why the National DPP works so well is because it is a lifestyle change program. It's actually a year-long program, but the reason why again, that's part of the reason why it works so well, because it is lifestyle change. Now, when you participate in it, you will either be in an in-person small group or an online small group. And these are offered, classes are offered nationwide, and basically we are looking for lasting lifestyle change. You discuss ways to eat healthier, to add physical activity to your daily routine, and to work with stress and sleep and coping skills and what do I do when I go out and how do I handle holidays and things like that. So the CDC recognizes that lifestyle change programs that meet these standards should include the following. It's very important that you use the CDC-approved curriculum, the order in which they offer the courses, the way that how they go in depth as far as each module. So that's important to be able to use that. We too have trained lifestyle coaches. It has a contract with Emory University where we have a master trainer come in from Emory, and we train our lifestyle coaches to run these programs for us, and then submitting data each year to show that the program is having an impact. And DHEC has people on staff who are available to help you with TA along the year, throughout the year, and then of course CDC has their experts as well who will help you analyze that data, analyze maybe where you could improve in your program to help people reach that 5 to 7% weight loss goal, all of that. So there's help available, which is important. Next slide. Now, you might wonder when we're looking at who is eligible for the NDPP. Basically, you have to be 18 years old or older. This is definitely for adults, BMI of 24 or above. You have to not have had a previous diagnosis for diabetes. We actually have a lot of people, because it's diabetes prevention, who will approach us. They've already been diagnosed. That would be diabetes self-management, but we definitely are working with the population that has pre-diabetes or has not yet been diagnosed with diabetes. And you can have gestational diabetes. You can self-report that as well. But you see the different tests that you can use, the A1C, the fasting glucose. Now, when to start a program, and we have many of our especially community-based and faith-based programs who ask us, does everybody have to come in with a blood test in order to participate? You do not. Now, the CDC does require that at some point, at least 50% of your participants in your small group have had one of these tests that through a blood test has confirmed that they have prediabetes. However, there is a paper test, a self-risk assessment one can take, and if you score in a certain range, it is most likely that you are at risk of developing type 2 diabetes, and you can start the program just based on that paper risk assessment. Next slide. Now, you may hear the term Prevent T2. It's used synonymously with National DPP, NDPP, but Prevent T2 is actually the CDC's new curriculum that they have developed. What occurred is that the initial, in 2012, there was a curriculum that was adopted by CDC that was used, and we still have some of our programs that use that, but then CDC went in and developed their own program called Prevent T2. So basically it is just the curriculum that is part of the National Diabetes Prevention Program, and if you go to CDC's website, both curriculums are there. You can use either one, and again, we have coaches that are trained in both, and Emory University will train coaches in whichever curriculum they choose to be trained in, so it's no problem. So as I mentioned to you before, Prevent T2 is a year-long program, or National DPP, it's a year-long program. What you will have for the first 6 months is there are 16 modules that you need to complete within the first 26 weeks of the year, of the time that you're in that program. So those 6 months, what they're trying to make sure that you build skills on food tracking, on physical activity, learning about food portions and measurements and things like that, and how to burn calories, all of that. So after that, that's called the core part of the program. And then after that, in the next 6 months, you go into post-core. That's where you meet less frequently. You have a minimum of at least 6 meetings over the course of that next 6 months. You can have more, and many participants actually want more because they really like the camaraderie and the group setting. So you're certainly welcome to have more. You have at least 10 modules that are available to you. In the 2012, you have 15 modules in that last 6 months that are available to you, and as long as you do a minimum of 6 of them, then you are within the standards of the program. Our sessions also last about an hour or a little less, but when you're in these sessions, in these small group sessions, that's when you set and talk about meeting goals. You build relationships and fidelity with other participants. You realize that this very personal struggle is not just your struggle, that other people have some of the same issues, and it's really good when participants are able to help each other find solutions to their problems, people who work the same place that they work, maybe worship in the same place that they do. So they realize, okay, well, people just like me are doing this, so maybe I can do it too. And they work as a group to help them overcome and meet their challenges, and it really is a great group setting. Next slide. So what we're doing, and especially in participation with WISEWOMAN, is participation in the NDPP is free. As we had stated, it's supported through either WISEWOMAN funds, it's covered by 1305 or 1422 grant funds. So at this point, there is no cost to participate. Now, WISEWOMAN participants are expected to at least come to the program in that first 6 months. You have to join by at least the third session. I mean, it's great if you're there by session 1, but if a group has already started, you can make up those first 2 sessions as long as you're in there by the third session. And it is important to attend. CDC has a minimum number of sessions that need to be attended. Again, we do tell our lifestyle coaches that people can make up sessions if they miss one, but you are expected to make every effort to attend. And then the WISEWOMAN participant has the added opportunity of having the health coach in addition to their lifestyle coach that would lead their NDPP program. They also have the health coach with which they can discuss their progress and any challenges that they may have, and they can touch base with them at least once a month. All right, next slide. Now, there's also a risk reduction counseling portion of the WISEWOMAN screening visit, and we are absolutely thrilled that DPP must be discussed with all WISEWOMAN participants in order to meet that eligibility. And again, that's such a help because it's very easy to overlook or not look for opportunities to discuss this, and you'd be surprised how many people have conditions that coincide. So it's wonderful that they're doing that. And the WISEWOMAN Health Coach also has to follow up with all DPP referrals and provide coaching for DPP participants. So another great way, because even if the physician refers someone into a DPP program, to have someone that's actually going to follow up with that and make sure that they at least get connected with the DPP group is absolutely wonderful. And the health coaches sessions with DPP participants are billable. That's one thing Linda wanted to make sure that people understand. There is an opportunity to be reimbursed for these services, and again, we're always pushing for insurance coverages as well, that you see listed the different ways that you can get reimbursed. We absolutely want you to be able to take advantage of those funds. Next slide. And DHEC, as I stated earlier, we have a unique opportunity right now where we can a lot of heavy lifting and offer anyone who would like to become a national DPP site, we have the opportunity to offer you certain assistance. So we can help you with completing it's an assessment tool that we have called the capacity assessment, just so going in, sitting down one-on-one, talking with you about your leadership, your structure, the resources that you have available as far as human resources. Is this something that you can provide for the people that are in your purview in your organization? We'll give you assistance with completing the application to become a pending CDC recognized site. We have people on staff who will give you technical assistance when it comes to not only filling out that paperwork to become the recognized site, but understanding the standards and everything. We will train up to 2 individuals within your organization to become national DPP lifestyle coaches. We bring Emory University in, they're master trainers, and if you look on the Emory University website, each one of these training seats cost $750 each, but we will train up to 2 people in your organization with our grant funds to be able to continue to offer that program to your individuals. We'll also help you with marketing materials and get you flyers and posters and different things that you can do, maybe web content. However you all reach the folks that you normally reach gives you an opportunity to use some of those marketing materials. CDC has really done a great job of having an entire arsenal, and Emory University has a learning collaborative of lifestyle coaches and NDPP programs across the country. People have come up with their own flyers, their own class schedules, things like that, to give you an opportunity to say, okay, I don't have to invent anything. There's something that I can easily adapt to my organization. And while at least now, September of 2018, we have funds that will allow organizations to offer a small stipend to those that become lifestyle coaches and to give participants incentives, different things. They don't have to be the same types of things, but we have some people offer say, Walmart gift cards, anything from that to paying for transportation for someone to get to the facility, anything, an incentive such as if you attend so many sessions, we'll help purchase a pair of running shoes, things like that. So we have funds available to help organizations to implement those things. And we have found that offering things like stipends and incentives helps with retention in the program as well. So next slide is just my contact information. If you have any questions, if anyone has any questions now, they're more than welcome to share them. I'll be happy to answer them. But also, please feel free to send me an email or give me a call. And you might want to give me a call until I get internet next couple of days.
Okay, well, just quickly, Michelle, we're going to hold Q&A until after everyone is presented. And so this is a perfect opportunity for you, if you have a pen and a paper, to jot down your questions that you've had about the information presented so far on the TOPS program and the National Diabetes Prevention Program. So jot those questions down. You can type them into the chat box, and then when we come to the Q&A session, I will go in the order of the questions received, and the panel can answer them one by one. I'd like to thank Michelle Harris for sharing this rich information, and what I'll be doing is providing a quick summary of just main points from the presentations today for those of you that may have come in during the middle of the presentation. So we're going to keep on moving this train. And our next presenter, what I love is to always hold up the people, the foot soldiers that do this work all day, every day. So I give to you Lisa Melendez. She is a licensed massage therapist and a certified health coach. Currently, she is a WISEWOMAN health coach at the Little River Medical Center. She is a native New Yorker, born in Brooklyn and raised in Queens, and relocated to South Carolina, and bringing her gifts in terms of her background in nutrition and health coaching to serve women in her program. She's a wife and mother and entrepreneur. Just reading her bio just made me tired. She's a 4th degree black belt and a co-owner of a karate studio and a wellness center with her husband, Nelson. So this is a powerhouse here and a gym, and I'm so blessed to be able to share her with you all today. In just the 3 months since she's been with the WISEWOMAN program, she's a newbie, but she is knocking it out of the box. She has served over 150 women, and dare I say, as of today, she served her 168th woman through the WISEWOMAN program. So I give to you Lisa Melendez, and she is going to educate you today about health coaching.
Wow, thank you for that great introduction. I appreciate that. All right, so let's get right into this. So what is the health coach? That is something that I get all the time. My primary care physician did not even know what a health coach was. I think it's a fairly new title that people now have. But a health coach basically helps others achieve their health and wellness goals by providing science-based, trusted information, positive encouragement, and continued motivation to achieve optimal health, right? So it's not just about what I think that you should do when I talk to a person, but it's about what has worked in the past, what research has been done to prove that we in fact can assist you in lowering your blood pressure, lowering your cholesterol, as well as your blood sugar. When I meet with patients, I try to encourage them and motivate them through this process. So giving them support and stimulating them, allowing them to know what they can do. Next slide, please. All right, so let's talk about health coaching versus the risk reduction counseling. So 2 things happen when a patient comes in, is identified as a Best Chance Network participant, which then in turn can be a WISEWOMAN participant, is that they're going to go ahead and meet with their provider, and they meet with the nurse. They fill out a billable packet of information that I will then have access to that tells me what their blood pressure is, what their weight is, and then also some basic information that kind of gives me a baseline to help them in reference to, are they a smoker, what are they eating, that type of information that is very helpful. But once they get to me, then it's more of a one-on-one relationship building, trust building session that I have with the patient. And my sessions, the sessions usually last between 30 and 60 minutes. And I meet with them first initially on a one-on-one basis where I'm actually meeting them face-to-face. They get to meet me. They get to see my personality, see that I actually care about their situation, eye-to-eye contact, asking them questions. And then after that, then I can talk with them on the phone, but I still like to be able to do it face-to-face. So today on my 168th, I'll have to say that because I'm very happy about that, she came in. So even though we can have our second and third sessions over the phone, I do like them to come in, again, creating that relationship that we actually care. But with that said, after that third session, they can still come in to meet with me three more times. Next session, please. Thank you. Identifying patients' needs and customizing a health plan. That's very important because you want to be able to, each patient is different and have different needs. So you want to find out what they like, what is it that they're doing on a daily basis. There's a form, a handout that we have here that we can talk about later that if you like, that helps guide me through my session with each patient. And so I will ask them questions like, what are you drinking throughout the day? What is it that you're eating? Are you eating fruits and vegetables? What are the variety of colors that you're eating? Are you eating fish? What are your stressors? Are you sleeping? Are you exercising? So this form that we have that you guys will have access to that you can use or adjust as you see fit will help you in how do I know what to ask the patients, and then you can adjust it for you. It's important that we ask these questions for them so that we have a baseline where then we can use our expertise in whether or not the path that they are on is going to help them with their optimal health. It says here also, does she smoke? We also have and work with the South Carolina Tobacco Quit Line, in which that is a free service to our Wise Women participants. And they fill out a form. Basically, it's just a telephone appointment that they're committing to, where someone from the South Carolina Tobacco Quit Line would then contact them and take over from there with me or the health coach following up with the patient. I did have a patient that signed up in March, I want to say March 29th, and as of April 6th, she stopped smoking. She just needed that extra push. Their, family is too close. Everybody tells you to stop smoking, but until you hear someone outside of your circle telling you the health risks, and this is the reason why possibly your blood pressure is up, your cholesterol is up, your sugar is up, why you don't feel well, supporting them, encouraging them, motivating them to get the help that they need so that they can, again, get on the road to optimal health. So finding out also family history and who is their support person at home. Are they doing this on their own, or do they need to have a sit-down meeting with their family to talk about how we can get that junk food out of the house? Maybe change that ice cream to yogurt or the potato chips to the popcorn. Who does the shopping at home to be able to bring in this, nutrition-dense food versus empty calories? Who's your support person besides the health coach at home to help you be successful in this program? Next slide, please. So tips for motivating patients to complete 3 or more health coaching sessions. I have personally a wish list that they fill out, which is one of the handouts that you guys can have as well. I had a woman today with her daughter who was actually in tears filling it out because she was actually writing herself, what is her, from scale of 1 to 10, what's your motivation to begin and end this process? What is your why? Why are you doing this? Because your provider wanted you to see me? She admitted that initially her scale was a number 3 on her first session with me. She wound up in the ER twice after that, and today her scale of 1 to 10 was a 10. Her why was because she couldn't drive anymore because her blood pressure is so high and she's dizzy, and she wants to be able to be with her grandchildren. She wants to be able to tour the country. So she wrote it down. I asked her to put it on her refrigerator so that she can see it every day. She's got to know that I'm going to follow up with her. Sometimes I make the appointments right then and there. Other times it's difficult because I'm trying to see other people, but I have my own schedule, and so I do give them a call, follow up on them. With her will be less than a month, of course, because she is dealing with some severe high blood pressure, high sugar. I also have some handouts that I give them. This is a great way, you guys, to get them to come into the office, because sometimes they just don't want to come in. They've already met with their doctor, but I say, come on in. I'm going to give you a heart healthy recipe book. I have a resistance band that I can give you to work out at home, and people like gifts. They like presents and things like that. I also tell them when I talk to them on the phone initially that, I don't know if you're aware of this, but you qualify to have your own personalized health coach working with you, and this is of no cost to you. So I make it kind of sound like they've won the lottery, and because they're part of the Wise Women program, they qualify for their own personal health coach, versus you need to come in and see me like it's another appointment where it's going to be boring. So they get their energy from me, from the health coach, having them feel like they are important. And we've got things for them that's going to get them on the right path. And then also giving them some goals, some things that are attainable, something that they can do easily so that they can come back to see you. Lots of times they're drinking Mountain Dew, Pepsi, and soda, and they drink more than one, and it can be as simple as bringing that down, 1 can of soda versus 3, or drinking 1 more bottle of water. And then, very supportively you can say, because I'm going to catch up. I'm going to call you and I'm going to ask you how you're doing. And if they create that relationship with you, then they also want to make you happy, right? Because you've got that relationship already started. Next slide, please. So the fortune is in the follow-up and the follow-through. So fortune is for all of you providers out there that are listening to this webinar today and wondering how this will work. I see many, many patients, but I am personally not one to just sit down and do nothing. I've got to be busy, got to be moving. I am calling people. I'm asking them to come in to see me. Sometimes even I put a little note and I make a flag on the computer system to just call if I know that their grandchild, which is their Y, has a recital and they're so excited about it, and I'll just call them to ask them how that went. You'd be surprised, and many times they will tell me this has never happened, people don't do that, they don't care. Well, we care. We want to follow up on you because that is how they're going to continue, that they were just not lost in the shuffle. So you want to make sure that you do that. And then in our sessions, when we meet with the patients, we do bring up TOPS, if there's a TOPS in the area that they live, or the quit line to stop smoking, and you want to follow up with that as well. Again, they have their own personalized health coach that is working with them and that cares about the outcome of their journey. Next slide, please. So tips with working with Latina women. This is super funny because although I am Puerto Rican, when I was interviewed for this position, they asked me if I spoke Spanish, and I laughed because I do speak Spanish, and I'm able to speak with them without help, but I understand it better than I speak it. So this completely motivated me to brush up on my Spanish. Everyone listening here can do that. I can send you some cheat sheets to be able to do that. Believe it or not, I have taken out my cell phone and gone to Google Translate. Espinaca means spinach, and I did not know how to say that in Spanish, but that did not stop me from talking to this woman, and they get a kick out of it because sometimes I sound very Spanglish, but it's great. So if you're not Spanish speaking and you sound Spanglish, they are going to completely be happy that you are trying to communicate with them, that you are not shied off from having this conversation with them to better their health. Understanding their food, their culture, is something that easily all of us can do listening to this webinar today. You know, since I'm Puerto Rican, I understand some of our root vegetables that we eat have high calories. So I'm able to kind of giggle about that and tell them about cutting that in half and adding, you know, this vegetable with that, drinking more water, stop drinking the, you know, the cola that we drink that has a lot of calories and stuff like that. And then having things available in Spanish for them to read. So even though you got your basic information out with working with a Latina woman, you can still give them information for them to read on their own. If they've got questions back to you that you don't understand, I take out my cell phone and they put it into Google Translate. I get it, and we continue our conversation. It has never been a negative. They appreciate it. My mother-in-law lives with me. She just appreciates when people try to talk with her, especially if we're trying to get them to eat healthy. Movement matters. Have them exercise, and we see the numbers drop and they get better health care. Next slide, please.
Lisa Melendez, thank you. That was awesome. Thank you so much for dropping those jewels and those nuggets. Y'all, if y'all are on the line today, I really hope that you walk away with some concrete tools to do what we're asking. If you're a health coach, wonderful. And maybe this has reactivated you to get active in your practice and offer these services. But the whole point of this is to become a wise woman provider. But briefly before I move into that, I promised y'all that I would summarize. For those of you that may have jumped on the line late, we have had a wonderful webinar where we've talked about the Taking Off Pounds Sensibly program, the fact that, and just some things to highlight here in terms of the whole title of this presentation was the win-win solution. For the patient, they can have their membership paid for 1 year by DHEC funds. And then they can also, you have the opportunity to co-locate a TOPS program in your office, if you didn't hear that. When we talk about providing these services in rural communities, anyone tells you that you have to do as much as you can with that woman while she is there. So it is also an opportunity for you as providers to become a one-stop shop and be rewarded for it by having staff that is certified, you know, through programs like the National Diabetes Prevention Program. In terms of your quality improvement activities, you would receive credit for these type of activities. I also wanted to just highlight the fact that in addition to becoming a Wise Woman Health Coach, you also have the opportunity to be sponsored by DHEC grant funds to become a diabetes prevention coach. So for all intents and purposes, you're receiving certifications, training, and the opportunity to bill for these services. So it's a win-win on the patient side and a win-win on the provider side. So I really wanted to highlight that as well. Let's see if there's anything else that I wanted to make sure that I shared with you all today. If you are in Marlboro, Bamberg, Allendale, Lee County, Williamsburg counties, these are some of the counties that are the hardest hit by morbidity and mortality rates. Fancy speak for birth and illness rates, some of the highest in the state for breast cancer, cervical cancer, and heart disease. If we took a map, you would see a compound effect of cancer and heart disease happening in the same communities. Essentially, what I'm saying to all of you today is there's no reason that a woman should be dying from breast cancer or cervical cancer or even heart disease with these free services that are provided. And really speaking personally, as someone who is privately insured, I have to pay for each one of these things separately. And guess what? Depending on what bills are due, I may have to just focus on one of those things and do my fitness pal for free on my phone to track my weight and to track my food. And so I really want to just emphasize the potential that you have to provide comprehensive quality health care services. With that said, I want to share with you a wonderful opportunity coming up. We are going to have a health coaching boot camp, and this is going to be put on through the partnership with the South Carolina Office of Rural Health and DHEC's BCN and Wise Woman programs. If you are not a Wise Woman provider, please contact Linda. I will be providing her information at the end. But the most important thing is you have to be a Best Chance Network provider. So guess what? You have the opportunity to sign up for that program as well. So that is available to you as well. For those of you that are Best Chance Network providers but haven't added on the Wise Woman service, this new contract year, you can simply add it on to your contract without having to do a separate process. So I wanted to offer that to you as well. We are now at the Q&A session. If you have any questions, please type them into the chat box if you have them, or raise your hand and I can unmute you. So far it looks like we do not have any questions. As we are waiting, I'm going to send you the link to the boot camp. You can cut and paste this into your browser and then go ahead and register. So there are a couple of questions that I have for the panel as I was listening to all of you today. Before I start that, if you look on your right-hand side in your control panel, there are 5 handouts that have been provided to you today. Number 1, you have the new Wise Woman health coaching fee schedule. So it gives you detailed information about what you can bill for providing these services. The next 4 documents are the ones that Lisa referred to in her presentation. So she has the health coaching initial visit in Spanish. She talked about creating a wish list with your patients. That is available to you here in English and Spanish as well. And then a tip sheet to lower bad cholesterol, also in Spanish. So please download those documents. We are really big on the R&D, rip off and duplicate. And I want to thank Lisa again for providing those handouts. And we do have more. Unfortunately, we can only upload 5 today, but I have about 3 additional forms in Spanish if you are interested in those. So just shoot me an email if you are interested. Okay, let's see. Seeing if there are any questions. Seeing if any hands are raised. For the panel, I have a couple of questions in terms of really how you address issues of transportation. So in terms of women living in rural communities, if there's not a TOPS chapter or a DPP chapter, how would a provider who wants to provide these services offer them? Are there other alternatives? So I'd like to present that to the panel.
This is Michelle. Yeah, we have had that situation. The way that we will address that is we've had some organizations, especially say in the public housing authorities, who have said, okay, we'll come to you. So instead of having the class at their offices or at their location, they actually went to the community room at the particular housing authority location so that people right there in the community. Others use the incentive monies that we provide through our grant funds to provide transportation for those that have said that that's a challenge for them. And then others have been able to partner, say, if the NDPP program is offered at a local church, the church has said, okay, for a participant that can't get to us, we'll use our church bus, our church van to support going out there to pick them up and bring them in. So those are the ways that some of our providers have addressed transportation as a barrier.
Awesome, Michelle. Thanks for providing that clarification. Linda or Lisa, do you want to provide any commentary on that particular question?
I do. This is Lisa. We actually have an employee here whose job is simply to pick up and return patients back to their home. So we're very lucky to have that. So if a patient cannot get here, either they don't have transportation or they just don't want to drive that far out, you know, because I personally am in 3 locations. I'm not in all 5 of them, but I go to 3. So Tom will go pick them up, take them to the location where I'm at. I will meet with them, and then he takes them back. So we're lucky to have that.
Okay.
This is Linda. South Carolina WISEWOMAN does not have transportation services to give. One thought I had was, let's say the patient wants to go to TOPS. Perhaps she can get her friend or neighbor who has a car to join TOPS with her. Of course, WISEWOMAN does not pay for the neighbor's TOPS participation, but at least the WISEWOMAN participant could ride with the neighbor and do like a ride-sharing program to get to those meetings.
And then if I remember correctly, Linda, your presentation, you did say that as long as there are 3 participants that are 3 persons available, that you can start a TOPS chapter in your office. So say if you're a clinic or a healthcare center, you can actually have a TOPS chapter co-located. Is that correct? Did I hear that correctly?
It's actually 4 people, so like me plus 3 other people.
Okay.
Yes. So again, the convenience is having a DPP at the WISEWOMAN screening site, having a TOPS chapter at the WISEWOMAN screening site, you know, having your health coaching right there at the site, or if the health coach could travel among your healthcare facilities or even out into the community. Yes, convenience is definitely a way to break down the barriers to access to these programs.
Okay, thanks so much for that clarification. So there's the other barrier taken off the table. So we've talked about folks coming to provide services where the patients are. Some facilities provide transportation, but the whole idea that you can provide TOPS and DPP services under one roof, again, is a win-win for providers. I didn't include these slides today, but I do want to emphasize that if you are going through the patient-centered medical home accreditation process, you receive credit for being able to demonstrate that you are providing these type of educational services that typically you would have to refer out for. So as long as it's integrated into your EHR and you can document that, you receive credit for that. Medicare has rolled out the Merit Incentive Payment Program. Many of the activities in the WISEWOMAN program you can receive credit for. And enhanced reimbursement from payers. And this applies to HEDIS measures as well as the physician quality reporting system. So again, just want to continue to emphasize just the benefits across the board. It is work, but if you can provide these services under one roof, and I'm particularly talking to my rural providers, you'll be better set up to be competitive in the new process of reimbursing based on value, not volume. So I'm going to check one more time just to make sure I don't miss any questions. There are none. Want to see if anybody has their hand raised. No hands raised. So thank you so much for joining today. These are the next webinars coming up. We will have webinars for 2 more Thursdays. Next Thursday, June 8th, I will be bringing back Genevieve Gamble, and she works closely with Linda in the Wise Woman program, and she's going to provide step-by-step instructions for completing billing forms to ensure optimal reimbursement. So for my billing and my coding ladies, my back office ladies, please tune in next week. On June 15th, we want to talk about having annual screening events. So we do have BCN and Wise Woman providers who actually have screening events at their facility, or they partner with other organizations to provide screenings to the community. And the benefit of not only providing screening is also you could create an opportunity to establish relationships with women who have fallen through the cracks because they are uninsured or underinsured. So this is also an opportunity to attract patients to create a medical home for them. So we will have some program coordinators as well as some community folks sharing their expertise in terms of having great screening events. And then we will wrap up this training series with a live health coaching boot camp. That is what I alluded to earlier. That will be Monday, June 26th. This will be our keynote speaker and trainer for the morning session. This is Dr. Cheryl Dye of Clemson University. And she will be providing in-depth training on what a health coach is and how they function in outpatient facilities and the community. And not only is she going to be providing training, but we're also going to provide practical skills building opportunities. You doing role plays, patient provider role plays, really looking at your workflow process, because how many of you have been to a training and then you get back to your clinic and you're like, okay, what am I supposed to do now? And I have patients in front of my face and I'm just trying to handle the workflow that I have in front of me. We want to give you the opportunity to really plan strategy in terms of how you can improve your workflow process to integrate these services at your facility. So that is the Eventbrite link, and you also have that in your chat box as well. I want to bring your attention to the handouts. Please take those goodies that we've provided for you today. And beyond BCN and Wise Woman at the South Carolina Office of Rural Health, we have other services that help you grow your quality improvement activities at your facility. So we have quality improvement coaches that can provide technical assistance around the patient-centered medical home accreditation process. We spoke about MACRA, the merit-based payment system, and preparing you for that. We have the opportunity to provide on-site technical assistance for that as well. We also have a staff person, a director who handles those of you that have been designated rural health clinics and making sure that you stay in compliance and give you good billing and coding advice to maximize your earnings for the services that you provide to the community. As always, this is not the first or last opportunity to connect with us. I have provided Trinessa Jones information. She is the Best Chance Network Director. If you are not providing those services, that is the first step before you become a Wise Woman provider. So that's her information. Linda, who's offered her time today to share more in depth about the Wise Woman program. If you are interested in signing up, please contact Linda. I am your moderator, Tiffany Simpson-Crumpley. If you have any interest in speaking or being a guest presenter, we have 2 more webinars to go. So I'd love to feature people that are actually doing this work. So that's my contact information as well. And Lisa Melendez, that's her contact information at Little River Medical Center. So if you are a health coach or you want to pick her brain about what this looks like on a day-to-day basis, she is available to you to answer questions. Michelle's information was offered previously, and this webinar will be recorded. Please give us about 24 hours, and then once that recording is ready, you will receive an email and you'll be able to take advantage of that and pass it along. Please share this wonderful information. Once again, I would like to thank Linda, Michelle, and Lisa for sharing their expertise today. And I am going to conclude this session. Please take a moment to fill out the evaluation, and I'll see you next week. Take care, and thanks so much for spending time with me today.